Dr. Jeffrey Karp is an associate professor at Harvard Medical School, Brigham and Women's Hospital, as well as principal faculty at the Harvard Stem Cell Institute. Dr. Karp's primary research focuses on stem cell engineering, biomaterials, and medical devices. Dr. Karp has also invented globally recognized technologies, including nanosensors and a new neonatal adhesive. While his work cannot be summed up in a few short sentences, suffice it to say that Dr. Karp's work is celebrated and published in papers and book chapters. He has more than 30 issued and pending patents with work recognized by CNN, National Geographic, and BBC. Dr. Karp, please tell us about your research focuses.
Absolutely, my pleasure. So my lab focuses at the interface of multiple disciplines, including material science, biology, and medicine. And really the goal is to develop technologies that can be rapidly translated to the clinic. So we work in many areas, including, I think, some that you've highlighted, medical adhesives, drug delivery systems, stem cell therapy, medical devices, and diagnostic devices.
And how did you get into this kind of research?
Yeah, so I did my training in chemical engineering at McGill University in Canada. I'm Canadian. I think, a degree in engineering is really a degree in problem solving. And as I went along, I was kind of focused mostly towards kind of classical chemical engineering problems, which involves pulp and paper industry and refrigerators and things like that. So over time, I started to lose interest in the topic, although I really was interested in the problem solving. And I was actually in a coffee shop in one of the later years, and I overheard people talking about tissue engineering and drug delivery and all sorts of really interesting things that I had no idea about. So I asked them about what the course was, and it was these upper level courses. And I decided essentially to extend my degree by a year. So I spent an extra year at McGill while all my friends graduated, so that I could take these really exciting courses. And so that's how I got into the area.
And what about regenerative medicine interests you?
Yeah, so I think that the potential of developing new technologies that can not just treat symptoms, but actually completely change the course of a disease, or can completely change the outcome for patients. I think that's really exciting, and I think that drugs have primarily focused on small molecules, and these can only take things so far. So these are the drugs that typically pharma is developing and advancing, and very few of them can actually alter the course of a disease or can completely regenerate a tissue. And there's tons of patients who are waiting for organs, and there's simply just not enough to transplant. So I think the huge unmet need, and then also the incredible potential to be able to combine materials with stem cells and be able to deliver them in a way that can promote regeneration of tissue is just a really exciting area.
I agree. Human embryonic and adult stem cells each have advantages and disadvantages regarding potential use for cell-based regenerative therapies. One major difference between adult and embryonic stem cells is their different abilities in the number and type of differentiated cell types they can become. Are you more interested in adult or embryonic stem cells, and why?
Yeah, so I've actually worked with both embryonic stem cells and adult stem cells, and I think both have incredible potential. And I have focused mainly on adult stem cells, as I think that they can more rapidly be translated to the clinic. So if you take one type of adult stem cell, which is a mesenchymal stem cell, there's somewhere on the order of 300 clinical trials that are being performed around the world with that type of stem cell. With embryonic stem cells, it tends to be a lot less because it's a younger field. And I think that embryonic stem cells have a lot of advantages in the sense that you can potentially obtain any cell type in the body in unlimited quantities, which gives you remarkable potential. Whereas if you take adult stem cells, they're much more defined. So they're what we call differentiated, and so they're more mature, and so they're more limited in what you can do with them. But we've been working with the adult stem cells for longer. So I really want to be able to translate technologies rapidly to treat patients. And so I'd like to see in my lifetime some of the things that I work on actually make it into the clinic. And so I tend to focus more on technologies that consider this timeline in mind, and that's why we focused on adult stem cells. But I think embryonic stem cells have incredible potential.
Excellent. There was a TED Talk where Anthony Atala provided a demonstration of printing organs. His lab at the Wake Forest Institute for Regenerative Medicine is focused on answering the question, can we grow organs instead of transplanting them? What is your take on this, doctor, and how far away in terms of time do you think that we are from actually being able to make this happen?
Yeah, so the field of tissue engineering has existed now for about 20 years or so. And I think there's been incredible progress that has been made. And Tony Atala has, clearly one of the leaders in the field. And he's been able to develop organs like bladders, for example, that he's transplanted into patients and shown some really incredible efficacy. And so I think that initially in the field, there was this belief that we'd be able to translate things much faster than we have. And I think that we've just over time encountered a lot of major challenges in terms of growing an organ outside the body, but then how do you transplant it and have it engraft in the body and then have a blood supply and be connected to the nerves, and so each organ is has its own challenges. So I think that what we'll end up seeing are things like maybe pieces of organs that will end up getting to the clinic first. So one can envision maybe a patch for the heart, for example. We've seen a number of different designs of valves that have mechanical valves that have made it into the cardiac field, and I think tissue engineering valves and things like that. I think will enter the clinic first, and then probably over the next 10 to 20 years, we may start seeing some of these more complicated, larger structures be translated. But I think we're really on the cusp of a lot of these technologies, to make it into the clinic. And there's a ton of people that are working kind of round the clock on this all over the world.
Excellent. What big breakthrough would you like to see in stem cell science in your lifetime?
Wow, what a great question. I think that there's been a major challenge to advance stem cell technologies to the clinic to help patients. And I think there's lots of considerations that one needs to take in working with cells, because unlike traditional small molecules that are the current drugs that are being prescribed daily by doctors, cells actually require very different manufacturing. They require different handles on the control of the cells, the quality of the cells, and batch-to-batch variability. So there's a lot of challenges with cells that we haven't seen that are very different than drugs. And I think what would really be great is if we could move beyond the bone marrow transplants that we've seen, which have been really successful. Cord blood has been really successful, although it's important to consider that that's really the most successful form of stem cell therapy that we have right now in the clinic. But a lot of patients still get graft versus host disease, which is a debilitating disease. Maybe 40% of patients that go to bone marrow transplant. But I'd say bone marrow transplants are really the most successful cell therapy that we've seen. And I think what would be really great is in the next 10 to 20 years, if we see some of these adult stem cell therapies actually make it to the clinic and improve quality of life of patients and can address unmet needs that the traditional small molecules can't. And I think we're really close to seeing that. I really think it's a matter of probably 10 years or so before we really see some of these approaches that can address hundreds of thousands of patients. And it's been a long time coming.
What to you is the future of stem cell research?
Yeah, I think that one of the great challenges in stem cell therapy, where there's a lot of research focus now, is to try to control cells following transplantation. So this is, we can exhibit exquisite control over cells in a petri dish. Mm-hmm. We can do all kinds of things to control exactly how we want cells to behave. But when we transplant them into the body, we lose complete control over these cells. So they're entirely at the mercy of the biological milieu. And so wherever they reside in the body, they actually may behave differently because the environment is different. And so I think what is really an important area of research is to better understand how cells behave after we transplant them. And if we can better understand that and develop better models, I think we'll be able to develop a lot more effective therapies because cells that are in the body behave very differently than in a petri dish. But yet the petri dish is really the main mode of which we're studying the cells. So I think we need to move beyond that, study how cells actually behave in the body after we transplant them, and then develop technologies that control where they go and what they do when they get to their final destination.
Interesting. Can you tell us a little bit about what nanosensors are?
Sure, I'd be happy to. Um, so I think, kind of following on this idea of being able to study cells after they've been transplanted into the body, the nanosensors are a platform where you can actually attach sensors on the surface of cells. And so what that allows you to do is when that cell receives a signal from a cell that's nearby, you can actually use the nanosensor to intercept or to actually listen in on the cells communicating with each other in real time at the single cell level. So this really gives you a capability that we don't presently have, and that is to be able to sense molecules at the cell surface. So if a cell nearby is communicating, it's going to be sending out molecules and they'll be diffusing to that second cell surface, and then we'd be able to detect that. And when the second cell it wants to communicate with the other cell, it will release factors, and we can monitor that in real time.
Oh, wow. Okay. And can you please also describe to our viewers what new neonatal adhesive is and its function?
Sure. So one of the major problems in neonate units is that tapes are used that have been designed for adult skin, but premature babies have very fragile skin. So they don't have a mature epidermis, the top layer of skin. And so what happens is that when you have tapes that attach temperature monitors or EKG leads or trach tubes, for example, and you remove them, it can cause massive damage to the skin, and in some cases, that damage can last a lifetime and cause impairment to that child. And so what we did is we developed a new generation of neonatal adhesive that actually considers the patient population, which are these premature babies with very sensitive skin. And so we developed a tape that could affix a tube very strongly to the skin, but is very easy to remove. And so it requires about 10 times less force. And so it addresses what I think is the biggest challenge in neonate units, which are these tapes that just cause incredible damage to the children.
And can you tell us what are you currently working on and what do you have planned next in your career?
Sure, yeah. So we're working on a variety of different things. One of the areas that we've been focusing on is type 1 diabetes. So we're developing devices to encapsulate islets or beta cells so that they can be transplanted into patients and can help maintain the survival of the cells following transplantation. And then also be able to control the response rates so that when the patient eats, for example, it doesn't take too long for the insulin to turn on and get to the right levels to control the glucose. So that's one of the projects that we've been working on. We've also been doing a lot of work with intestinal stem cells. So these are stem cells in the lining of the gut, the epithelium, and we've actually figured out a way to grow them in unlimited quantities. And what that allows us to do is enable us to now obtain all of the cell types in the lining of the intestine in really large quantities, so we can start to screen for drugs that potentially could enhance barrier function, that could help potentially control antigen presentation in the gut, can potentially also help control the microbiome, which is now being implicated in all kinds of different diseases. This is the bacterial lining of the gut. And so we now have tools that allow us that didn't exist before, that now allow us to identify new drugs that potentially could treat diseases like inflammatory bowel disease, like Crohn's disease, or ulcerative colitis, and many others.
Excellent. Well, Dr. Karp, thank you so much for your time, and thank you for your dedication to science and to healing.
All right.
Thank you so much.
Thank you. My pleasure. Nice speaking
Thanks.
with you.
Nice speaking with you too.